My name is Chris White. I am with the Northwest Arkansas Tobacco and Drug Free Coalition. I have worked the Drug Free Communities grant that the coalition operates for the last 7 years. A little bit of history on the coalition. The coalition was started over 20 years ago as a grassroots effort for individuals that were concerned about the negative impact of secondhand smoke exposure. And little by little, through education and advocacy work across Fayetteville initially, the group worked for several years, and finally, and it was very controversial at the time, got the city of Fayetteville to pass the first Clean Indoor Air Act policy in the state of Arkansas. And it was all over the papers and news at the time, but it turns out it was a huge success, and the state of Arkansas later on modeled their Clean Indoor Air Act policy after the work that the coalition had done in Fayetteville. Initially, the coalition was the Northwest Arkansas Tobacco Free Coalition. In 2013, to expand the focus of the coalition applied for a Drug Free Communities grant and was awarded the grant. It's a federal grant that has a potential for a 10-year lifespan. We've started year 8, and once we brought that grant underneath the coalition, it expanded the name to the Northwest Arkansas Tobacco and Drug Free Coalition. The Drug Free Communities grant focuses on youth populations. Our focus substances are marijuana, underage alcohol use, and prescription drug use and abuse. Our grant also has two goals: to reduce youth substance use and abuse, and to increase community collaboration. And so it's a wonderful partnership that our coalition has multiple grant funding sources, and they all have the focus of prevention. The Drug Free Communities grant has the focus of prevention with that extra increased community collaboration. And so we get to go out, we get to connect resources across the community, and that just further strengthens the work that we do. If we can bring as many people to the table as possible, we can impact people in ways that we didn't think possible without having them there. Over the last 8 years, we've done a lot of great work. Some of the highlights are things that we've done through focusing on environmental strategies. So, for example, we have helped install and distribute prescription drug take-back boxes across our community. I don't know that we could identify a law enforcement department that does not have one currently. In other words, we have made sure that everyone in Washington County and then throughout the 4-county Northwest Arkansas area has access to prescription drug disposal box to get rid of unused and expired medications, thereby reducing the amount of access people have to potentially deadly medications. Also, we work hand in hand and collaborate with our tobacco prevention grants. We've worked hard to secure policies. For example, the Fayetteville Housing Authority went smoke-free. The Fayetteville Parks Department has gone smoke-free. And there are a few other park systems in smaller municipalities up here that we've helped go smoke-free. Some of the highlights of working with the coalition is you really get a sense of how the inner workings of all the different systems within a community, whether it's law enforcement or legislative or business or the religious sector. You see how they all work individually, and then you can be that connector to connect law enforcement to the religious sector, or connect business to the civic organizations.
My name is Deb Crawford, and I am the regional lead representative for the Partnership for Success grant. One of the highlights of what we've been able to do is we've been able to identify existing youth coalitions as well as establishing a number of new youth coalitions throughout the Northwest Arkansas area. And through these youth coalitions, we've been able to do a lot of really awesome things in terms of prevention and letting the youth come up with what they think are some of the solutions to preventing the use of particularly alcohol and marijuana. I have actually 44 years of experience working in prevention, but I've only been with the Northwest Arkansas Tobacco and Drug Free Coalition for about a year and a half. My passion has always been working with youth, and so some of the highlights that we have been able to accomplish in the past year and a half since I've been here is we've held teen summits for several of the counties in this area. We've had a great attendance because we've been able to work directly through the school districts to get those youth and get them involved in participating. Our grant focuses primarily on the prevention of underage drinking and marijuana use. And so with the current situation, working with COVID, we've had to do a lot of our coalition meetings with our youth virtually using Zoom or other platforms, as well as the teen summits that we were able to offer this year. Red Ribbon Week was a different experience this year in that we were only allowed to provide materials and things of that nature, but I've gotten some great feedback from some of the educators in our schools who have said how much those materials have been used and how the youth have responded to those things and the lessons that they have actually presented as a result of those materials.
Hi, my name's Amanda Eddy, and I work with the Northwest Arkansas Tobacco and Drug-Free Coalition. I'm a project coordinator with the Tobacco Prevention Cessation Program grant that's funded through the Arkansas Department of Health. I've been with the coalition for about 2.5 years now. So some of the highlights working with the coalition and working with my grant in particular have been working with youth on vaping prevention, e-cigarette prevention, and tobacco use prevention. A lot of youth are really inspiring to work with, and just kind of changing the social norms around tobacco use in general has been the highlight of working with the coalition. One of my favorite things actually is doing cigarette butt litter cleanups. You find a whole bunch of interesting things when you do that, and it's just kind of cool to see how much litter you pick up, and it's like an immediate satisfaction of knowing that you've cleaned a park out of toxic waste. And you can absolutely demonstrate the amount of cigarette use happening within a community and where it's happening, and you can document that, and that's data you can present to city councils to kind of change social norms around smoking.
So my name is Beth Huff, and I am the project coordinator for the Masargo grant. It's a grant out of Pine Bluff, Arkansas, through the university there. And we focus on minority initiatives within Northwest Arkansas, and we focus more on youth along with those different minority groups. So here in Northwest Arkansas, we focus on working with groups such as Hispanic and Marshallese with tobacco prevention and cessation programs. So I've been with the Northwest Arkansas Tobacco and Drug-Free Coalition for just a little over a year now. And one of the big things that we've been able to do with the Masargo grant is really work with some youth groups in the area. We work with the Project Prevent Youth Coalition to create chapters in Northwest Arkansas. With COVID, unfortunately, a couple of our chapters that we've been working with are not able to meet, but we have two that are currently very active, one in Bentonville and one in Fayetteville. And it's very rewarding working with these kids because they take the initiative to really focus on tobacco prevention within their communities. So in the last year, one of the most rewarding and fun things that I've been able to do as the Masargo grantee here has been to create TikTok videos. We had bought a giant tobacco prevention mascot suit before COVID hit, and we were looking for ways to utilize it. And we decided to make fun TikTok videos that would reach out to the kids in our community. It's been very fun, exciting, something new, pushing the boundaries of what I've been used to doing, and just a really cool way to reach our community and our kids that are within it.
Hello, my name's Lori Ray. I'm with the Region 1 Regional Prevention Provider. I have been with the Regional Prevention Provider for 25 years. During that time, we have had the benefit of working with many drug-free coalitions. Some of the highlights of working with our coalitions and within the Tobacco-Free Coalition is getting Smoke-Free Fayetteville started and successfully passed back in 2001. As an active member of the Northwest Arkansas Tobacco-Free Coalition, the Region 1 Regional Prevention Provider has shared mutual deliverables. Some of those include prescription drug takebacks, where we have shared resources and volunteer efforts in planning these events. We've also helped support coalitions in our area working together on helping them grow stronger. We've attended trainings and workshops together, but we've also brought back information to the coalition to help educate the members there and even provide them the opportunity to go to some of these national conferences. I think that's been a great highlight of the role of the Regional Prevention Provider.